Good evening, how are you? Firstly, let me acknowledge the Wathaurong people, the traditional owners of this wonderful part of Australia that you're in. My apologies for not being there this evening. Can I acknowledge Greg Sam, the CEO of the Rural Health Workforce, Helen Murray, Future Workforce Program, Rural Health Workforce, Karen Eccleston, Manager Project Team, Rural Health Workforce, health educators and students. I said earlier that I apologise. I do really apologise for not being able to be with you this evening. Unfortunately, I was required to go to the Cocos and Christmas Islands over the last couple of days, which has necessitated me travelling through Darwin. It's unfortunately impossible for me to get down to you tonight. So again, my sincere apologies, because it was my intention to be there. I think this is a very important conference, for a number of reasons. Not only does it bring young students together who are intent on working in the health field, but I think it opens up your eyes to new opportunities and to meeting people who you'll have long-term relationships with in your profession. And that to me is really very important. I've been to your conference previously and I was actually really very impressed by the people who are dedicating their lives to working in the health field. And of course, my intention is to try and attract as many of you as possible to work in rural, regional and remote Australia. I live in Alice Springs, as many of you will know. I have done for over 3 decades. And I know the difficulties that confront people who live in really remote parts of this country and in regional areas, where the health workforce is a real problem. We don't have sufficient doctors, we don't have enough nurses, we don't have enough allied health professionals. And that's an issue for all of us, because we know that people who live far away from the urban centres have shorter lifespan, they have higher rates of chronic disease. They're just sicker people. We also know, for example, that they consume tobacco at a higher rate than their city cousins. So there are a range of issues which we need to address. And I noticed that the slogan under which you're gathered here this evening is Connect, Engage, Inspire. This is an opportunity for all of you to connect as members of the National Rural Health Students Network. You will excuse me if I refer to my notes, and I know this is an unusual way to present, but one of the main reasons you're here is to learn and be inspired by leaders, policy makers and other professionals right across the health and education sectors. You know, I know, that as students, you are the future of the Australian health workforce, and there should be no doubt about how highly we value you and what you do now and what you will do into the future. You are the key to our goal of keeping Australia's healthcare system at the top of the world and in ensuring the Australian health workforce is distributed right across the country and across every demographic. And that is a real challenge. The National Rural Health Students Network has an important and supporting role, and representing medical, allied health and nursing students, it is a vital one. We especially value, I particularly value, the promotion of rural health careers to students across Australia, encouraging them to consider a career in rural and remote practice. Now, I've come across a number of students over recent months in various parts of remote Australia. I came across some students, for example, at Yuendamu, which is, for those of you who don't know, is roughly 250 odd kilometres northwest of Alice Springs along the Tanami Track. Very isolated community, going through difficult times at the moment, yet we do have medical students there, students from the Australian National University who are doing part of their training there, and that's very important to us. I had a former employee of mine, Dan O'Neill, who was working with me in my job, who was a graduate of ANU, who went then and decided he had enough of me, he wanted to go and do medicine. He went and did the Flinders course and did most of his training in the Northern Territory. Very important, Dan has now got a career mapped out for him. He's going to be a professional, I think a physician, and he's in his professional training right now. Very important that we acknowledge those students who have made this choice, and having made the choice have dedicated themselves to the very extensive and hard training that they have to undergo, you have to undergo, to reach the professional levels that are required to work in the Australian health system. Of course, the area that I'm most intricately involved in is Indigenous health. The health of Aboriginal and Torres Strait Islander people is of concern to all of us, I know that. And we know that Aboriginal and Torres Strait Islander people experience a burden of disease 2.5 times that of other Australians. Chronic conditions like cardiovascular disease, diabetes, cancer, respiratory and kidney disease play a big part in all of this. And I'm sure that's not news to all of you, to any of you, you'd know that. But I see it every day. And I don't know if I've mentioned this the last time I met at your conference, but I first got engaged working with Aboriginal and Torres Strait Islander people in the late 1970s, which makes me a pretty old bugger. And before many, if not all of you were born. But let me tell you, I was involved in working in the northwest of South Australia, working on a project from the Australian National University, headed by a great Australian, Nugget Coombs. And this program was looking at the impact of government programs on Aboriginal people, particularly socialisation processes. I came to meet and enjoy the company of and learn from some very, very unique Australians. Aboriginal people, Pitjantjatjara, Yunkadjara and Ngarrindjara people in that part of this country who are living in the most deprived of circumstances. Very little housing, none when I first arrived there. There were no houses at all at the little community that I was working from, Pitjantjatjara, in the northwest. It's now a very vibrant place and very different. Of course, in those days there was no telecommunications. You couldn't sort of pick up your iPad or your iPhone or do text or tweet or any of that. In fact, the only way of communicating was on a Royal Flying Doctor radio schedule. Very difficult and very different times indeed. But I met these Aboriginal men principally, but also many Aboriginal women, but worked closely with them on and off for about 3 years. Sadly, and this is so sad, most of those men and women have passed away. And they've passed away from diseases which were preventable. Chronic diseases which are now endemic in Aboriginal and Torres Strait Islander Australians' lives: diabetes, kidney disease, respiratory disease, cardiovascular disease. And some were required to move away from their country for treatment, never to return. That is so sad. And it's something we must do all we can to prevent, to change. And that's why your role is so vitally important. Because without the dedication of students such as yourselves, those who are going to make the health workforce of the future, who are learning and understanding what it is to become a really good health professional, what a difference you can make in changing the life circumstances of these Australians, as well as many others, but these in particular. And I say to you, it's a huge challenge. But some of the finest men and women I've met have worked in the public health system, or in public health areas, not necessarily in the public health system, but in public health, for all of their working lives. Doctors I know who I first met at Pitjantjatjara when they were working from a little community called Kulka, just around from Pitjantjatjara as part of the Pitjantjatjara Homelands Health Service. People who are still involved in working in the health service, delivering health care, working with trying to prevent disease in Aboriginal and Torres Strait Islander communities. These are great Australians, and people I'm very, very proud to have met and retain an acquaintance with. They are friends. But they are friends for a range of reasons, but I most admire their dedication to their work. And if they can be an inspiration to anyone, they're certainly an inspiration to me. But if you can get mentors in your life who are doing something which is unique or different or challenging, and they inspire you, can I just say to you, learn from them. Because there are so many good people in our health system. So many good people. You know, we're involved in some very difficult tasks. You're aware that we want to close the gap in Aboriginal and Torres Strait Islander mortality, life expectancy. Difficult things to do. And the challenge is not beyond us. And one of the most difficult things, very simple things really, if we could just stop, or not stop so much, because that's almost impossible, I suspect. But if we could bring down Aboriginal and Torres Strait Islander tobacco consumption rates from where they are currently of around 50%, 48 I think it is at the moment, to half, and bearing in mind that the tobacco consumption amongst the general population is probably somewhere around 16 or 17% currently. If we could bring down the tobacco consumption rate by half, we'd make a measurable difference to life expectancy for Aboriginal and Torres Strait Islander people across this country. Not a simple thing to do, however. A very, very difficult thing to do. I've retailed this story on a number of occasions. I was at a meeting in Katherine, as it happens, 18 months or so ago, with a group of Aboriginal elders. I was there to talk to them about my job as Minister for Aboriginal and Torres Strait Islander, responsible for Aboriginal and Torres Strait Islander health. And I said, look, if there's one thing you can do, it's stop smoking. And this old bloke got up and said, hey Warren, you can't tell us to do that. You can't stop us from smoking. He said, you know, that's part of us. When I was working as a stockman, I got paid in flour, tea, sugar and tobacco. That was part of me. He said, I can't stop. It's part of what I am. What could I say? Other than to say to him, look, I understand, old man. I understand that it's difficult for you, very difficult for you. But could you please, try and tell your children or your grandchildren not to smoke. And understand what it means to smoke over a long period of time. You may be healthy, but many of your friends will have died as a result, direct result, of smoking tobacco. Now, you know, difficult message. And I see this old man every now and then, he pulls out his packet of cigarettes, he said, I still haven't stopped, Warren. And I say, well, I wish you had. But there is a problem for us, that the message is very difficult. But we're very proud of the work we're doing in that area, and Tom Calmer is leading our team. We're spending in excess of $100 million on trying to stop and bring down, well, stop if we can, but bring down tobacco consumption amongst Aboriginal and Torres Strait Islander people. We're employing healthy lifestyle workers and tobacco action workers right across the country to work with Aboriginal communities to get local solutions to what is a very, very vexed and difficult issue. So I say to you, there are many challenges. There are challenges on the operating table. There are challenges looking at people's eyes, operating on cataracts, preventing trachoma. There are challenges getting people to eat properly, making sure they don't consume too much sugar. We need to recognise that some good things are being done. A little community called Armata in the northwest of South Australia, the community took a decision, a very, very brave decision, to take all high sugar content drinks off their shelves. You know, that's a tough decision. That means you go down to your local supermarket, you go into Ballarat, go to the local pie shop, or go to the local corner store and ask for a Coke, you'll get one. You go to the store at Armata and ask for a Coke, they'll give you water. Very brave thing. Or certainly another low sugar content drink. Very brave thing. But it's changing the behaviour of people. And this is all being done from the community. So the challenge for us is, whilst we're professionals, to understand the people we're working with. To understand and try and align what we do with them. Bring our expertise to them and try and work with them in a way which brings about change. Look, I've spoken for too long, and I do apologise for not being here this evening. I really do apologise. You're a great lot of people, You should be very, very proud of the course you've chosen for your lives. You will make a significant and a very important contribution to the health outcomes of Australians across the board. But I hope most of you will take a really good decision and decide to work in the bush. Good night and thank you.